Hello and welcome to the ultrasound area of the Hitachi healthcare booth at RSNA 2015. My name is Matthew Ernst. I'm the marketing manager for radiology and women's health. And today I want to talk to you about an exciting new addition we have to our ultrasound portfolio. So I'd like to introduce you to Sofia, our automated breast tomography system designed for whole breast bilateral ultrasound scanning of women with dense breasts. So rather than just try and replicate the experience of conventional handheld breast ultrasound, Sofia is a complete reimagining of what whole breast ultrasound can be, focused on speed of acquisition, efficient review, and patient comfort. So Sofia's unique approach begins with this 92mm array transducer that's been embedded in the scanning cone here. And by using trapezoid imaging, we can expand that to an effective field of view of over 200 millimeters. You'll notice that the patients in Sofia are not scanned in the supine position, they're scanned in the prone position. So all it takes is just a little bit of lanolin ultrasound lotion placed in the scanning cone here. The patient will then lay down on this memory foam table, placing her breast into the scanning cone, nipple centered. Once positioned, the user will activate the automated scan using the touchscreen panel right here. During the course of the scan, as it goes 360 degrees, we're going to gather approximately 800 individual radial images. And at the end of just 52 seconds, we've acquired the entire breast in a volume acquisition that can be sent over to the radiologist workstation. And Sofia is compatible with a variety of ultrasound systems, from a premium to a portable, so that whenever you're not doing whole breast ultrasound, you can convert Sofia to a standard scan table and do any kind of regular handheld ultrasound with one of the many probes that our systems are compatible with. And now I'd like to introduce you to Mark Stribling, who's going to talk to you about the unique tools we have on the review side.
Hi, I'm Mark Stribling. I'm CEO of iView Imaging Corporation, here to talk to you today about the review station for the Sofia automated breast tomography system. The Sofia workstation is designed to make the radiologist as efficient as the Sofia table makes you efficient in acquiring data. So if you remember, the table, we can acquire the whole breast radially in 52 seconds. Here we need to be as efficient. You need to be able to evaluate a volumetric breast in less than a minute so the radiologist can get through those cases and we can do the best thing for patients. So here you have the representation. We've acquired hundreds of images in the 52 seconds. Now we've put them in a three-dimensional volume, which you see here. You can review the breast from the rib cage to the nipple or vice versa, or in any direction. Now, what's unique about this is because we have the 3D volume, now we can slice that and let you look at any point in space from three directions simultaneously. This is the axial slice, and that's what you use for the purposes of diagnosis. And the coronal slice gives you positional data. So it always tells you that you're at 12, 3, 6, 9, so that the radiologist is always oriented to what they're looking at in the breast. And then we've made it very simple. Because we acquired the data in a radial format, we want you to review in a radial format. And if you'll notice here, you'll see the structures moving and you'll see our position moving here. And this is how you would survey a breast. So here we see some benign cystic features with posterior enhancement. And as you can see, I want to point out that in all of these images, you see the skin line here, you see the arc of the pectoralis here. That ensures that you're getting all the tissue in your field of view as you're reviewing. And this coronal view gives you the positional data. So now I'm going to continue to rotate through the case. And so everything that we've looked at in this case so far has been benign. And we see another large cyst coming up here. And so it's benign until it's not. And in this case, right here, you see a solid mass within the breast. Very complex case because you're looking at a cyst, you're looking at a mass, and you're also looking at something lateral that's an abnormal anatomical feature. So this software, reviewing radially, makes it very easy in less than a minute to go through the entire breast, identify these structures, and make a determination about the patient so that you can move on to the appropriate next step for that patient. But again, if our acquisition is efficient, our review has to be efficient, and it is. And there's one more important thing I'd like to share with you, and what that is that our system was built to be DICOM compatible. What that means is you don't need yet another dedicated review workstation, another monitor, another set of equipment in your reading room. Actually, we just use your PAC system. We plug into your network, we send our images there, we archive there. Use the monitors you've already purchased, use the mouses that you have. We simply run as a node, and that means that it gives you the flexibility to have radiologists in multiple rooms, multiple buildings, multiple states, multiple countries, without any additional cost to the system. Thank you for your attention today as we've discussed Sofia for automated breast tomography. If you'd like more information, you can visit us on the web at hitachialoka.com, or you can contact your local Hitachi representative.